Welcome to Ductus Exemplo. Today we'll be covering the FEHB, the Federal Employee Health Benefits. This is about understanding your healthcare options. This is for the 2026 coverage year. Open season will be starting on November 10th, and it will be going through December 8th. We will be covering the FEHB plan costs, and this will be for the biweekly payers. We'll also be covering information that you need to determine what's right for you within what they provide. Then we will go over framework and approach, because we will not cover everything for every plan since there are a lot of them, but this will help you know how to focus in on what you need to ensure that you get the coverage that you need. Finally, sometimes the plan does not cover what's needed, so we're going to be going beyond what their documentation shows. This means we're going to show how to call the providers and how to get that information that may be unique to you. This can include things like specific prescription information, specific medical needs, or things that just may generally not be covered with the general brochure and disclosure information. Sit back and enjoy. Thank you for visiting Ductus Exemplo. Our goal is to provide meaningful and accurate information to help make a positive difference in the world. Our core value starts with integrity first. This is critical to building trust and making the positive difference. Our guiding vision is to inform responsibly. We are going to break down complex information to derive simple truths for improving our lives. We ask that you provide feedback on what you think of the videos and what topics you'd like to see more of. And in return, we make the promise to continue improving our efforts to bring you information that's worth your time. Thank you.
It seems you can move much faster if you are healthy first than if you are wealthy first.
Now we're going to be going through the different costs and breakdown. We're going to start running through some of these plan options. There are two types of programs offered. The FEHB is where we're focusing on, but the OPM site also offers the PSHB, the Postal Service Health Benefits. That is out of scope for this conversation, but I'm letting you know that it's going to be the same process of going through there to identify the premiums, but our premiums are not going to reflect that in this video. It also breaks it down further into fee-for-service or FFS, basically the nationwide plans, and then the HMO plans. We're covering them a little separately. We'll focus a little more on the fee-for-service because nationwide plans apply to everyone, but we will use the DC area. I'll use Maryland to show an example of a local area. And we will be focusing on the premium rates, not the former spouse and other rates. That is also out of scope for this video. All right, categories of plans. HMO has regional plans and specific area for service, whereas the fee-for-service is nationwide. It does say that there are 8 providers, but the Panama Canal plan is only for people living in Panama. That means there's really only 7 nationwide plans. Breaking down those plans, we can see the Panama one, we've got the big red there, but we've also then got a breakdown of who actually is covering this from insurance. We've got 3 of the plans, APWU, Compass Rose, and GIHA under a United banner. We've got 2 plans, the Foreign Service Benefit Plan and MHBP under Aetna. We've got Blue Cross Blue Shield as itself, and Samba has Cigna. So that helps you get an idea of what's going on under the covers, so to speak. And it shows that each of these providers have some different plans. However, it may quickly result in you canceling out some plans as being for you. And a lot of these probably are tailored for specific people. I won't be able to cover everything, but here in cost, we can at least break it down. Here again, we're showing the United plan. I'm only going to do this for the fee-for-service because this gets to be a lot. We can see that the way that they say they offer so many different options in the list is they show a line for self, +1, and family. Here, I'm just going to let 3 seconds pass or so, move on. It's going to show some of the costs. If you need, pause it, look at what you need here. This shows some of the base costs. Where it says NA for out-of-network max, it means there is no coverage for out-of-networks. Here again, same thing. Here's a good surprise. We have a red here because this +1 option costs more than the family option. I've called them, I've asked them about their coverage. It is the exact same coverage. What that means is if you are defaulting into a +1, you are paying more in this plan than if you opt for the family plan, which you are fully authorized to do. You will literally have the same coverage and pay less based on my conversations with the provider. And here again, GIHA, they have a lot of plans. One of them does not cover out of network. The others have some coverage whatsoever, or some coverage for network. The out of network max is going to take its own conversation. I'm really hesitant on that because in my call with a lot of the providers, a lot of these individuals are providing an out of network max, which you pay a lot more for. And then there's a lot that's not covered, which means they don't pay anything for these costs. It doesn't contribute to your max out of cost. So you're just kind of left high and dry in a lot of areas. So I'm very hesitant without really looking closely at those out of network costs, even if they're there. So this is the plans and the coverage. I made a little map to make this a little easier, showing the cheapest plan at Compass Rose all the way up to the most expensive plan, the high option with Samba. But that's the base cost. By breaking it down into a base cost, it means that when you sign up, that's what you pay. There's 26 payments for these biweekly payments, and this is what it amounts to that you're paying under a family plan. Here on, we're only going to do a family plan because it starts to get very lot of options. If you need to do the same thing for individual or for plus one, feel free. I've already given you the note that some plus ones need to look at family because that's going to be the better option. Other than that, single and family options should be close to tracking in terms of the lowest cost to the highest cost. Now, the big surprise here is this high number. That's the out-of-pocket maximum based on the plans in network. So it shows that although Compass Rose may have a very low buy-in plan, and it may be perfect for you if you don't need health care, your maximum could be extraordinarily high. There's all sorts of reasons for why you might want one versus another. Some of these plans will also accumulate towards that out of coverage max faster. For example, if you pay a percentage versus a fixed fee, and if there is, prescriptions, which is usually the thing that really pushes people over the edge on these things. Prescription cost plans are very different from plan to plan. There is a formulary. We'll cover that a little later. For those that are in the Maryland, it shows that these are the options. It's a similar number of options to the fee for service. Now this has the same thing with the low to the high. I'm not going to spend much time on these because this is not focused specifically in one area, but I wanted to use this to kind of show an example of where these coverage pieces are. I actually particularly like some of these very tight spectrums. Like if you look at the Kaiser Mid-Atlantic Prosper Plan, it is amazing in that it's max out of coverage or out of network or in network coverage. The max cost that you pay are lower than some of your base costs. And that's for both the national and the HMO plans. The downside is you have to go to their doctors and there's whole different requirements. I'm not going to have time to cover a lot of that. But if you do have needs and Kaiser meets the need, it shows that it actually has some of the lowest limits there at that $12,230. And if I compare that, we come out here to this Elevate plan here, and we're already over that amount just in our base cost, which means I would be paying more with no medical care than I would pay max under this Kaiser Mid-Atlantic Prosper choice. So this is one way to kind of look at what's needed and break down whether they're covering the things that you generally need, whether they cover the medical the way you need it. If you don't have any specific needs that go outside of what Kaiser covers, then I got to say that's going to be a pretty tempting option if you have medical needs. And then its low cost at the $4,230 mark really does have a draw. Now, I will throw out one caveat there. All of these ones with an HDHP, they're a little more expensive here. There's one here, one here. I'm not going to cover these three plans because, again, they're local. Going back, I am going to cover these plans here, the HDHP for GIHA and for MHBP. So this consumer plan is going to be a high deductible plan, and this GIHA plan is a high deductible. They're coming in at $56.06 and $57.99. I will be covering them because of the benefits of the HSA, and that way this will apply for everybody nationally, but you will want to review your local options as well to see if those meet your needs if you are interested in an HSA. All right, moving on. Now we're going to go into the depth of coverage. The service costs are going to be different on each of these plans. This is where you're going to have to do a plan to plan. We've got the cost, and if that's the number one, that gives you a good start. Now, a service cost is like when you go to the doctor, what do you pay? We're going to cover this very in depth. I've used both, like I said, the GIHA and the MHBP's HSA eligible high deductible plans. They also have the great factor that they offer 5% coverage on GIHA versus a $15 fee with MHBP. This gives you a way to compare some of the way these costs break down. Now, with a $15 cost, you know what to expect when you go to the doctor. There's no other questions. That's how fixed cost works. But with a percentage, you could get charged based on whatever that negotiated amount is. And to know the negotiated amount, you would have to reach out to the insurance company. However, if you go out of network, this is where it gets a little fuzzy. You're going to have the negotiated amount as your starting point. Now, both of the plans out of network are going to make you pay some percentage or some amount of that covered amount. So if it's like $100 and you go out of network, they'll pay you up to the $100 and then tell you you actually owe $40 more or whatever that percentage is. Then anything over it, they may make you pay also because that's outside of their coverage. The difficulty here is that extra coverage based on the conversations with the insurance providers, they are saying that they will not contribute to the out-of-pocket max. That means that your out-of-network is more costs for the same service, plus a bunch of extra costs that don't contribute to your max out-of-pocket. At least that was the conversation I had with Aetna. Moving on, negotiated rates with doctors and hospitals. Again, as I was saying, call to inquire. This is going to be helping you to understand what your costs are. Now, even when it's a fixed cost, I am going to throw out one more caveat. If there are extra surprises or charges that aren't inside that coverage, you may be forced to pay it. For example, you go to a doctor, you have these set charges, but then they send it off to a lab. That lab may not be in network, and now you have out-of-network costs. The hospital building may not be in network, but the doctor's in network. There's all these things that you have to go through to make sure that you are in network. That's going to be probably the biggest lesson I have is be in network as much as you can. Out-of-network is a very dangerous way to play. Pre-authorization requirements is the other thing you need to really understand. When is it required? How long does it take? And what happens if you fail to get that pre-authorization before service? A lot of them are having a lot of extra fees, a reduced coverage, higher percentages of payout, and a lot of these extra fees are potentially completely in the realm of not covered even under out-of-pocket max. That means that this is where they have their mitigation for risk. They're not going to incur these things for you just getting medical care, but it also brings up a lot of anxiety for people who want to make sure they have coverage for the things they really need. And finally, medication costs. Outside of the pre-authorization issue, medication costs are the one thing that will probably reach your plan max. I've not seen a lot of other cases where that's going to be possible. Now, well, out of network. The formularies they provide vastly different costs. I've had some medications that I've been looking up just to kind of look around that vary between formularies by thousands of dollars, which means the plan provider you go with may very significantly affect how much it costs you and whether you're going to meet the deductible or not. This is where something like Kaiser Permanente, they have fixed costs. So if they determine it's medically necessary, their coverage may cap it at like $150, whereas some of these other percentage ones, they may have other caps like $500 max for your prescription, or they may be uncapped and are saying, well, you're going to be paying the whole amount. Now, if you do go with the high deductible, you may be paying the whole amount until you reach the deductible and then the max copay. Those are things to all be aware of. Now, what are the red flags? I've kind of hinted at this a little bit already. What is not covered in network? That's going to be the first question that I always want to know. What is not covered in network? What is not covered in network? What is not covered in network? Now, this may surprise you because this is not always going to be something like, yeah, we don't cover that. It may be the idea that we do not have a doctor in your area that is going to be available to cover that need. So if you do have a medical need, you need to ensure not only that it's covered in network by the literal issues that you have, but also that there are doctors available that can meet with you to do that. Now, I have called some of the peoples on the list because they have this list that's provided. And at least for United, I've found that a significant percentage of the doctors in that list are either no longer existing or don't practice, or in some cases, the addresses they list aren't even medical centers. So be aware that these lists, while they may look robust, if you don't use them to understand who you're going to go to as a doctor before you sign up for the plan, you may be in for some unpleasant surprises. The other piece is the wait that you have to do. If a doctor tells you it's going to be over a year to get coverage and you only have coverage for a year here, well, it's completely worthless for that coverage because you literally can't use it. Same thing with what's not covered out of network. Because if you're forced out of the network, what happens? Now, some people will have a waiver. This is where you have to talk provider to provider. If they don't have an available provider that's in network, they may have a coverage option or exemption that will actually take an out-of-network provider and have them be in network for you for that purpose. But you must take the steps to do it. That is a beautiful benefit that can really help you if you're in one of those situations. And again, that's a custom talk with the provider to make sure that your needs are met. And that's why it's so important when you have unique needs to call the insurance provider and make sure to understand what you need to do. Now, moving on is the list of doctors updated and accurate. We covered that. How long do you wait for appointments? We did cover that with talking about how some of these appointments may be over a year. And what is the denied delay risk insurance companies introduce to your care? I've had to kind of add this because in the last couple of years, there have been significant issues. Not all of these are risks from the insurance company. For example, when doctors are so full that they cannot see you, that is a huge delay risk that can affect you. And you are limited to the providers that are available. So that's one thing to keep in mind. It's a related thing, but it's not always direct. The other piece is the insurance companies that need pre-authorization, or if there's things that are emergency, what are the things that can deny your care, delay your care, or result in huge risks? We've seen a lot of news programs where people are even in surgery for cancer, and the doctor is claiming that the insurance company is requiring them to call in mid-surgery or not perform or delay care that is critical to the survival of the clients. All I can do is share with you some of these issues, make you aware. Beyond that, this is really just an opinion piece. I don't have more that I can offer. Framework. Here's kind of a checklist to help you walk through this stuff. Review the current doctors and prescriptions and determine if they are in network. That's number one. That means before you sign up for a plan, as best as you can. I understand that medical can change throughout the year. You may find that you need a prescription somewhere mid-year, whatever, that you didn't know you needed, and all of a sudden you're surprised with the costs. That's where you can look to switch. But if you know what medications and doctors you will need, see if they're in network, see who replaces it. If you need to switch, review the list beforehand. And no available doctors may mean no care. Talk with the insurance provider about the steps that are required so you know what's going to happen. If there's nobody in your area, what do you need to do? Discuss chronic diseases and medical needs with a call to the prospective insurer. This is what open season is for. If you're switching to a place and they don't end up covering your issues, it's not very useful. Or if there's going to be some significant limitations. I'm always myself terrified that I will try to switch and have some medical need, which I don't. This is just kind of perspective. Let's say I have some cancer or some crazy disease that's terminal and I'm trying to switch. The last thing I want to happen is for me to go in and say, I need my prescriptions. And they're going to be like, well, you can't get them because you need an in-network doctor to approve your care. And we're not sure you need the care because, we don't have the record of your illness. So these are things to really be careful of. This is probably the thing that locks people in with an insurance provider because they're afraid to change. So this is how we kind of overcome that and make that path forward so we know exactly what's needed. I spoke with this on, Kaiser, for example, and they said that they will honor one prescription. But in order to get more, you have to go through their doctors and have them introduce that into their plan and have that be deemed medically necessary if it's not in the list. So, there's a path forward. And as long as you do that, you're good, or should be. But now's the time to do that. Think of it like a job interview. Review how many medical visits and prescriptions you typically need. If you don't need much, you may not need a plan that offers all these benefits, and then you don't have to spend a lot of time here. However, I will encourage you to look at the HSA part. That's where things are a little different. And of course, if the plan charges a percentage or has a deductible, discuss the company's agreed amount of service. A couple years ago, a lot of your primary care visits, for example, were running around $100. Now it's common to see a $300 bill. This paints a stark contrast in what happens when your copay is $10 versus 10%. In the $100 example, it's the same. $10. But as it goes up to $300, now you're paying $10 still for your copay, but your 10% has moved up to $30. These are things to be aware of. Now to explore. There are some use cases we are not going to cover in here, but I want you to be aware of and be able to look up. How will travel, kids being in college, or divorce coverage affect your plans? There is the coverage for care, a little law or whatever that's noted in each of these plans that basically state if you pick a plan that is not covering kids that you are required by law to cover, they are going to force you into a different plan. So understanding what that coverage is and whether that meets the need is going to be really critical if you are in one of these positions. So this is where you will need to have a conversation with the insurance providers, and you will probably need to understand where your kids are or intend to be and how that's going to affect your coverage. Same thing, Medicare is a whole beast in of itself. We'll at least refer to it tangentially as we review the HSA stuff. The GIHA plan does not have any Medicare integration whatsoever. However, the MHBP consumer plan, their high deductible plan, they do have integrations. So there's going to be some huge differences in your coverage with MHBP versus GIHA if you have Medicare. Now, this is only going to be people who are old enough to have that. So it's going to be a smaller percentage. We aren't going to cover details, but it's worth noting. Also, for those who are younger, who may be only interested in other specific benefits, they may have things like gym, vision, dental, or, as I mentioned previously, the HSA benefit. The vision benefit is great because if you want just glasses or whatever, some of these plans completely cover it. You don't need a separate vision plan. That's pretty sweet. Same thing for dental. They'll cover 2 of your visits. They may even have a specific reduced cost for some small things like cavities. So if you just have small needs but nothing big, their plan has it all in one, and it's a one-stop shop. You don't need an additional dental plan unless you have further needs like braces, implants, and other significant dental that they call a class C or D or whatever medical care. Anyway, the other piece is the gym membership. Some will give benefits for it up to like $500 or something like that. Those type of plans can be very beneficial and meet your specific needs, especially if you don't really have other needs for medical. So this is how you can use your medical to meet your needs specifically. Now we're going to go into a site comparison here. I've got the link listed here, and I'll try to list that in the links below. I'm not going to have a zip code here because this is supposed to be a national one, but I will show that I am doing this only in this case for the active federal employee with a biweekly. As we move to these different categories, you may see some slightly different costs, but that is something that you can now explore yourself. I did look at their filters. Their filters are mostly broken. We'll just leave it at that. If you are going to be doing a filter, the only one I've really seen useful is the number of members. But even that's only limited useful on the list because as you do a compare, it will again include all self, plus one, and family. If you are doing plus one, you need to have plus one and family just to make sure that plus one is not going to be more expensive than family. Every provider that I talked to that was so far, and I did not call them all, was telling me that they're the same coverage. And you are even encouraged to sign up for family, according to the providers, when the plus one's more expensive. I don't know why it happened. It's just something to note. These deductibles up here, premiums, out-of-pocket max, they are a little nuts in the fact that they're not very useful. If you have a premium of $5,000, let's just start there, you don't have any pay bands that even pay that amount. And that's the same for like 6 of the 10 pay bands or amounts you can filter by. There are no plans in those categories. So these filters are not actually tailored to the data. They're just random. All right. Use the links in the compare tool. I've got a little copy here as we're going to be going through the GIHA and the MHBP specifically. I think that's going to be very useful. Brochure link is long, but it's got some good details, especially if you got unique situations to look in or specific benefits. The summary, it's a good starting point, but it can be very deceptive because there's a lot of things that can be outside of that or complex that just aren't quite summarized in a summary or aren't conveyed in a summary. The provider directory can smooth the insurance migration. So that can help you determine what doctors you need, and the RX pricing, that can also help you understand this is the costs. If you have specific medications, that is probably one of the best places to go. Go to your compare, go straight to these pricing tools and look at the prices of your medications, whether they're in network or whether they need pre-authorization, and those costs you can expect to incur. That'll be extremely helpful because some of these out-of-network costs or things with pre-authorization, it can be very difficult to get. If that is something you need, if it's a specific medication, say that what they cover may be a generic, you may have found it doesn't work for you or whatever, this is where you really need to understand what's the list and what's required if you need to get that. All right, this is the comparison site live. I'm not going to be going into the links here, but we're just going to be looking down. As you see, even though I would try to filter it where it's maybe just family or family and plus one, it's going to include all of them. So this will show you their biweekly cost. I don't like that they don't show you the base cost, which is the 26 payments of these things. That gives me a better idea of the total cost when I'm trying to compare for total benefits. So in this case, the GIHA base cost is $5,606 for family, and the MHB consumer base cost is $5,799.04 for family. Now moving down, we can see that although they're fairly close, we have a $400 difference here. We have an annual deductible, $200 for single, as I will focus mostly on family, but this will show it all. So we see it's a $400 deductible difference, but when we look at the contributions, that same gap is here. So we see the $400 difference in the contribution to your HSA. What that means, to help break that down, is if you don't need care at all, this gives you more money up front for MHBP before getting any care. That means $2,400. It also reduces the maximum you can contribute to your HSA. And we'll get to more on that. But this amount can carry over year after year. You can use this money for any medical, including things like cough drops or eye drops or your deductible, whatever. So it shows that this can build up. It can build up all the way to retirement, be used, in fact, as a retirement account. But if it is medical, it's tax-free. And the money that you put into this is also not taxed. So you're avoiding tax all the way around, and it gets even better. This money can generally be invested in the stock market or in other markets. So you can actually use this as a leveraged investment. All right, net deductible. That shows that this is your out-of-pocket. Again, this shows that it's the same for both. So it's on level comparison. Where it gets a little different is our out-of-pocket maximums are a little different, but that's only $1,000, nothing breakable. Here again, we get into the Medicare stuff. It shows there's generally no coverage. You do have a max out-of-pocket, but if I look up here, I guess it's a little, well, it's the same as the single, and I'm not sure what that means, like if that covers a family as well. This is where it would require more exploration. Basically, not covered. Whereas you see MHBP, you got a lot of member pays nothing. So if you do have a Medicare, that alone might be a thing that would cause you to pick an HSA here versus here. However, once you are eligible for the Medicare, you are no longer eligible for it to be HSA. They convert it to HRA. It will have different limits. So if you have an HSA, you're still allowed to keep everything in it and use it as you've used it before. But the money that now goes in it will be going into the HRA. It has a cap of like $10,000 or some odd dollars. I'm not going to be the exact here. This is just kind of saying that they're different caps and it's a different bucket. And once you quit working for a plan that's eligible, it's gone. So it is a user lose. It has a specific time frame, and you basically want to use this bucket first. Even if you have an HSA with $1 million, use this bucket first. If it's an HRA, if you have Medicare, that's the big note that I've got. Moving on. All right. Primary preventative, it's similar at least. Member pays nothing. There may be some differences for out of network though. That's what's not going to be reflected here. 5% coinsurance versus a $15 copayment. If the cost is $300, that's your crossover threshold here. That means 5% of 300 is going to be 15. Any billing that is over that means you are paying more on the 5%. Any billing that is less means you're paying more on the $15 copayment. That's a way to compare if you're calling for pricing. Same thing here, only it's a much higher amount. Emergency care at a $150 copayment versus 5%. And urgent care, $50 versus 5%. These accelerated fees can get up there very, very quickly. But it also means that your trade-off is harder to calculate. It's harder to know what your emergency care will be. And that's what may drive people to be in a $150 payment. However, 5% has generally been reasonable because if you think about that with $150, that is a significant emergency care bill. If you're getting some major work, I could see you exceeding that. But in many cases, that 5% is not terrible, at least on average. But having those limits can give some people peace of mind. That is definitely something to be in mind for. Where I really start liking MHBP is actually down here where you have a lot of member pays nothing. This is where it's showing me that these surgery and hospital charges, member pays nothing, you pay 5%. Well, we have the first caveat, is the hospital in network? And then we have all these ancillary charges, and this keeps going on. Room and board, member pays nothing, 5%. Other inpatient, member pays nothing, 5%. This is huge. If you have these types of needs or these types of concerns, this is where MHBP has a little bit more liability in terms of base cost, but the crossover threshold seems to be really fast where these costs can go out of control and they're at least managed in MHBP, and the pays nothing means these add up. These add up significantly because that's 5%, which can add up over cost. But then because there's all these member pays nothing, that's 5% versus nothing. These can really kill you. At least that would be my fear. Lab, X-ray, other diagnostic, member pays nothing, and NA. That makes it look like it's just not covered at all, which means it won't even contribute to your max in network or out of network. So these are things to be aware of where, we have a very big difference in benefits. A lot of yeses, a lot of similar things. And here again, this is where we have some conversations. Tier 1, Tier 2, Tier 3, all the way to Tier 6. It looks like Tier 6 prescriptions are just not covered under GIHA, whereas MHBP, it's a 30%. So you're way better off here. Over here, it's a 10% different. Now, it's difficult because these prices may not match. 40% of $1,000 may be better than 30% of $2,000. So those are the types of things you could run into. But the percentages do look better. Don't just rely on the percentages. Make sure you look up the formulary for each of these and compare. That way you are actually comparing apples to apples. Now the $10 copayment, that actually has a chance to hurt you significantly. A lot of your prescriptions are really cheap for some of the stuff like antibiotics or some of these basic meds that people get all the time. And in those cases, that 25% may actually come out to a lot less than the $10 copayment. I've actually had a bill where I paid less than $2 for medicine at a 25% coinsurance than I would have if I'd had a $10 copayment. It's a small benefit. It would only rack up if you had a lot of prescriptions. All right, moving down. Again, a lot of this 5% stuff versus $15. Physical therapy, even 5% versus $15. I've seen that their prices are also running around $300. So that's probably close to parity. A lot of times it may be a little less still with some of the physical therapy places, but a lot of them are actually up to those prices. Member pays all charges. At least it's the same on both, so you know what you're comparing. But this is a new piece that is in most of the plans. I believe it's a requirement. These things are just not covered anymore. That's one of the big changes. Here's another big one. If you have treatment devices and services like hearing aids, GIHA is not covered, MHBP is covered. These are the types of things that you're only going to get by reviewing some details. If you need a hearing aid, this could be enough to switch you over to MHBP. So I'm not saying one's better than the other specifically. It always is going to be based on your need. But as you can see here, these significant differences in what's even covered and not covered. Same thing, we go in the other direction. We've got dental. It is covered under GIHA, but not under MHBP. Same thing with vision. So if you have very low medical needs, seeing these basics that are covered here may push you over to GIHA. Basics, low, young, get your high deductible plan, put your money into the HSA, save it up until retirement even, use it for any medical you may have in the future for you and or your family, and you have a great plan. And when you find that your needs for medical have crossed over that threshold where it starts being more worth it for you to be under this other piece where there's more coverage, MHBP, what I'm seeing is that seems to be the ideal transition. Start at GIHA, and once your medical needs reach the right threshold, move to MHBP. At least that's my conclusion. And here we have their coverage. What we see is the darker circles are better. And in general, quality follow-up after emergency, we got poor on GIHA and high on MHBP. Again, this just really goes with what I'm seeing. If you really have a low need for medical, GIHA really may be meeting your needs. And as soon as you have higher needs, if you still want to stay HSA, MHBP may meet your need better. That kind of is in line with everything I've seen. Moving on. Again, understanding HSA is the plan may pay you money. And as you saw there, we had a $2,000 and $2,400 payment per year from each of these into your HSA account for you to use for any medical. You may contribute your own money. Here's where we have those specific limits: $4,400 self for 2026 and $8,800. That's what I pulled off of an IRS site. I've also seen some differences, so validate this yourself, make sure. And again, this is something that changes year to year, so you're going to have to follow this every year and make sure you understand your limits. It can be uncomfortable if you exceed those limits. You may owe money. It may have percentages you're charged off of it and other things that happen with the IRS that I just don't want to get involved in myself and is beyond the scope of this video. Money is also withdrawn tax-free for medical. It rolls over every year. There's no cap. There's a cap on what you can contribute, no cap on what can be in the account. And because you can invest it like a 401k retirement account, you can actually grow it. This can be $1 million account too. This can be your fourth leg of retirement for those who are in the government, where you got your TSP being one of your legs, your contributions to your whatever retirement, and then you got like Social Security. They call that the three-legged retirement stool. This could be your fourth leg where you're adding an HSA, so it's going to help mitigate your medical risks, and it also provides a leveraged account in that sense. In the plan brochure, GIHA is stating at this very bottom area here that the out-of-pocket limit for this plan may differ from the IRS limit, but cannot exceed that amount. And that's where they come in within what they say is the maximum limit. And here we have the amount in MHBP for their out-of-pocket exceed that, which is highly concerning when they're saying the IRS says you can't exceed that. I don't know if that means that GIHA is wrong or MHBP is wrong. And I also don't know what's going to happen, because if GIHA is wrong, well, they have a limit that's better for us, and that's good. But if MHBP is wrong, then they're technically violating an IRS limit. Does that mean the consumer benefits and can say, I wouldn't have to pay that additional $3,000 for an out-of-network since it goes up to $20,000 here? Or is it going to come back the other way and say, well, this doesn't qualify as an HSA and all your contributions are now voided and now you'll have to pay money for it because it's no longer a valid HSA plan? In telehealth, a good note: in networking, nothing; out of networking, it means it's not covered at all under MHBP. And GIHA says 100% reimbursement of plan allowance, but you'd have to validate your plan allowance and what the charges are going to be. These are some of the nuances I found in my little deep dive. Review your direct costs. It's easy. Review the availability of medical and prescriptions that will be specific to your need, and use your priorities and financial capability to determine what plan best suits you.